Type 2 diabetes is a public health problem because it affects 37 million people in the United States. That is roughly 1 in every 10 people. 1 in 5 people in the United States don't know they have type 2 diabetes, so they go undiagnosed until they have severe healthcare issues. Type 2 diabetes, also known as adult onset diabetes, is a chronic condition that affects the way our body processes blood sugar, also known as glucose. Within type 2 diabetes, our body does not make enough insulin or does not use it correctly, causing all the sugar to stay in our bloodstream, increasing our blood sugar numbers. Insulin is an essential hormone that is produced by the pancreas that breaks down food into energy and controls our blood sugar levels. Insulin signals the liver to store blood sugar. We should think as insulin as a key that opens the door of the cells of our body that glucose as energy. With insulin not working properly or our body not making enough, the blood sugar levels in our body increase and stay in our bloodstream. Symptoms of type 2 diabetes often develop slowly and quietly over the course of several years and can be so mild that you might not even notice them. Some people do not find out they have diabetes until they have diabetes related health problems such as heart disease or blurred vision. Many people go for a long time without being diagnosed. Some common symptoms are fatigue, blurred vision, excessive thirst, fruity breath, increased hunger, nausea and vomiting, and increased urination. Type 2 diabetes affects all parts of the body differently, and each person can present different symptoms, but these symptoms are the most popular within those diagnosed with type 2 diabetes. There is many complications related to type 2 diabetes, such as brain stroke, cerebral disease, cardiovascular disease, peripheral vascular disease, foot damage, and diabetic neuropathy. Risk factors of type 2 diabetes. Within your individual risk factors is your age, gender. There is a higher prevalence in males than in females, your lifestyle, your diet, and your socioeconomic status. In a public health perspective, when you have a lower socioeconomic status, you are impacted by more barriers for healthcare, so it puts you at a higher risk for type 2 diabetes. Your family history, social capital, and family connections are interpersonal risk factors to type 2 diabetes. It all depends on the environment of your home and what is eaten because type 2 diabetes is very rooted in within your diet. Within the community, access to healthcare could be a barrier and could put you at higher risk of type 2 diabetes. Access to health education and your built environment. There is ways to prevent type 2 diabetes, such as avoiding sugary food, getting adequate sleep, monitoring our weight, eating a balanced diet, and increasing our physical activity can decrease our risk for type 2 diabetes and prevent it.